Hey y'all, my name's Ashley and I'll be teaching y'all today about binge drinking. Okay, just so y'all know, binge drinking is defined as the consumption of an excessive amount of alcohol in a short period of time. The National Institute on Alcohol Abuse and Alcoholism says that it occurs when a person's blood alcohol concentration is 0.08 grams or above. This usually occurs to men who consume 5 or more drinks, or women who consume 4 or more drinks in about 2 hours. This is a very serious but preventable public health problem. If you don't think that's a lot of alcohol to drink in that amount of time, or you think you can do better, I bet you can't. Just kidding. I wouldn't actually tell you to drink that much in that short period of time, because do you want alcohol poisoning? Because that is how you get alcohol poisoning. Okay, so this explains to y'all what one drink is defined as. One drink is 12 fluid ounces of regular beer, 8 to 9 fluid ounces of malt liquor, 5 fluid ounces of wine, or 1.5 ounces or a shot of any 80 proof liquor. So you can see how much alcohol is in all of that. Okay, so who binge drinks? I know many of y'all probably binge drink since y'all are, trying to join a fraternity, but don't do it because it is very harmful. Anyways, so 1 in 6 adults binge drinks about 4 times a month, which is 8 or more drinks. It's most common in young adults ages 18 to 34, aka y'all. Men are twice as likely to binge drink as women. People between the ages of 35 and 64 actually suffer from alcohol poisoning more than young adults, and this could be due to their blood chemistry, the fact that they're probably on more medications than we are, and their drug preferences. And also, white middle-aged men are more likely to die from alcohol poisoning than anybody else. Okay, and this just is a graph showing the different statistics of the age groups that binge drink and what percentage of them do. Now, as you can see, we're pretty up there. Okay, so there's multiple risks that comes with binge drinking. There's car crashes, you have the potential to fall because you kind of lose your balance. You can accidentally burn yourself. People are a lot more aggressive, so it can lead to violence. You can get STDs because you're about to get with this girl that you like or whatever, and you just don't really think about things and then get an STD, or even worse, unattended pregnancy. And then if she keeps drinking after she has an unattended pregnancy, fetal alcohol syndrome. There's also chronic disease such as high blood pressure. You can have a stroke, and you can also get heart and liver disease. It can also affect your learning and memory too, and it can also lead to alcohol dependency. But last but not least, one of the major risks of binge drinking is alcohol poisoning. Okay, so binge drinking can also affect your body in multiple different ways. It can slow down your brain function, hence why your balance and coordination get a little silly as soon as you start drinking a little bit. It can irritate your stomach, which can cause vomiting. It inhibits your gag reflex because it takes away from the sensitivity in your throat. So that's one of the main reasons why people end up choking on their own vomit. It can slow down or cause your irregularity or even stop the nerves that control your heartbeat and breathing. It also causes your blood sugar to become extremely low, which could lead to potential seizures. And it dehydrates your body, which can also lead to brain damage. And it can also lead to death. And this is just another chart showing how alcohol affects the different parts, the systems and organs of your body. If y'all want to look at that, just let me know afterwards. There's multiple signs and symptoms of alcohol poisoning and binge drinking. Confusion and disorientation, the vomiting, seizures, your slow breath, blue tinged skin, especially around your lips and under your fingernails. You have a lower body temperature, which could eventually lead to hypothermia. People can pass out and become unconscious and not be able to be awoken. They'll have cold and clammy skin, and they could potentially lose bowel or bladder control. And this is just another little chart showing the different signs of alcohol poisoning, effects if untreated, which obviously death is the main one that we want to stay away from, the percentage of alcohol per drink, and then what to do in case there's signs, which the main thing is call 911. Make sure you're prepared to deal with the situations of somebody who gets alcohol poisoning. You don't want to be like this guy and just freak out and not know what to do, because you could potentially end up extremely harming your friends. So I'll tell you how to take care of somebody with alcohol poisoning.